Hi, good afternoon to everyone here. I'm Dr. Anirudh Anilkumar. Um, I deal with public health and infectious disease. I did my MBBS from Armed Forces Medical College. Since then, I've been focusing on medical research and public health. So let's get started. You must have seen the recent spate of increase in cases of dengue across the country, right? Especially with a focus in metros, since testing is more in metros. So basically, the agenda for this session is we'll be going through quickly and very briefly what is dengue and how does it spread. And it's important to know how it spreads so that we can learn how to not get it, right? So what measures to prevent bleeding and blood meal. Then we go through symptoms and signs of active infection. Basically, how do you know you have dengue? And after that, we move on to what to do if you have dengue, which is basically the warning signs that mean you need admission and the common symptoms which you might encounter, which require general care. And like I said, the warning signs which tell you when to head to the hospital. And we'll also cover in brief some supposed treatments which you're not supposed to do as well. So dengue, it's very important to establish that it's a viral infection, which means that there is no role of antibiotics, right? A lot of patients feel like taking antibiotics helps them recover faster. This is not true. And of course, it is transmitted by mosquitoes. Which mosquitoes? It's important to know. So the Anopheles mosquito is commonly known because of malaria, but the Aedes mosquito, which is also known as the tiger mosquito, as you can see, it has many more white stripes, is the one that transmits dengue, chikungunya, and a host of other diseases, right? So a little bit about the Aedes mosquito. It's called tiger mosquitoes because of the fact that they bite a lot and they're striped. They are aggressive day biters. So normally you're used to mosquitoes biting you when you're asleep at night. However, the Aedes mosquito is known to bite you during the daylight hours as well. They're especially active between dawn and dusk, which is basically the sunset and sunrise areas. This is important because this is a time when humans tend to go outside, right, for a lot of reasons, either coming back from work or heading to visit friends or for religious purposes, which is why, dengue spreads so much. So knowing that it comes from mosquitoes or is transmitted from mosquitoes, the first step that we can take for prevention is preventing mosquitoes from breeding, right? If the number is under control, the disease is usually under control. Always, as healthcare government programs have told us, stagnant water is where mosquitoes breed, especially the Aedes mosquito. The usual suspects, which water accumulates in commonly, are buckets, paint cans, and public access tanks, all these areas. But a recent addition, ever since urbanization, is AC drip collectors, even dish antennae sometimes, just because water is stagnant and accumulating, wherein mosquitoes breed. So even a relatively small 10 to 15 centimeter surface area is enough for the mosquito to breed. Okay. So obviously we need to work hard to prevent the accumulation of water. And if it's unavoidable, right, like your dish antennae or AC collection areas, you usually use chlorine or salt to prevent it from being able to breed because it requires fresh water. And there is Temifos, which is a biological insecticide, and a larvicide, which is used to prevent mosquitoes from breeding in these areas. Normally part of government programs, however, residential associations also do these things. And of course, cover sites which can be covered, right? Using lids for containers such as buckets or paint cans is a great way to prevent water from accumulating in the first place. And now that we know it's through mosquitoes, the second phase is obviously preventing the mosquito from entering areas where you live. The mesh covering on all doors and windows is a great way to prevent mosquitoes and other insects from entering your house. It's a very simple, low-cost solution and has a lot of advantages apart from just preventing mosquitoes from coming in. Houseflies also spread to be disease, cockroaches, everything. More specific thing would be mosquito nets. In India, we're all quite aware of it. It's a pretty low-cost solution and very useful, especially in endemic areas. Endemic areas are wherever a disease is more prevalent than usual throughout the year, right? In India, this happens to be the areas of maximal rainfall, usually towards the northeast. And the bonus of having mosquito nets is they're active in preventing all mosquito-borne illnesses such as malaria, chikungunya, yellow fever, right? Not just dengue. Same thing with mesh, right? If a mosquito doesn't enter, all the diseases associated with mosquito bites can be technically eliminated. And of course, we have the mosquito repellent devices as well, such as Goodnight, All Out, whatever brand you want, right? The important thing to note here is that the brand does not matter. The concept is what are you doing to prevent it? if you have no other options, this is a good idea, right? Ideally, go for the non-chemical options, which are mosquito nets and meshes. But if they don't work out, there is no reason why you can't use these devices like Goodnight or All Out, right? Or even mosquito coils, right? They're also perfectly fine to use. Organic options for people who have allergies and certain skin conditions which prevent them from using these chemical methods are things like using citronella or lemongrass oils. These have been proven through research to repel mosquitoes to some degree, not as effective as other things, but better than nothing, right? And of course, the final phase is what to do once a mosquito is in, not just breeding, but in your house. You need to prevent it from biting you, right? So when you're going outside, this is not just house. When you're going outside, try to wear long sleeve clothes and full pants. So the covered clothing prevents mosquitoes from having access to areas to bite, right? Because your face normally you're aware of. However, your extremities, like your ankles and your hands, if they're not covered, you don't even notice until the mosquito is bitten. And obviously, avoid playing or lingering near areas of stagnant water bodies, the most basic step you can take. And there is a lot of research supporting the use of personal mosquito repellent creams. Right? The commonest brand is, of course, Odomos. Applying these do reduce the incidence of mosquito bites, right? But they don't completely eliminate it. This has also been seen. And of course, if you live in a residential area, try to push for your residential association to carry out fogging with mosquito repellent substances. And also, as we discussed, using things like Tamifos to make sure that any water features like fountains or pools, right, they're all taken care of by larvicides. And Tamifos is very safe to use. A lot of studies show that it's perfectly fine to use. Now we come to the main sort of part of it, which is dengue itself, right? We're past mosquitoes. And the most important thing to realize at this phase is that 80% of dengue infections are completely asymptomatic. Right? This is very important to realize for two reasons. One, turns out that dengue is not as scary as we thought it was. Two, if you get reinfected, there is a chance that you don't even know you've been reinfected because you didn't know you had a dengue infection the first time because you were asymptomatic. Right? And we'll come to reinfections later, but just keep that in mind. Now, out of the 20% that are symptomatic, less than 5% have severe symptoms, right? And from the severe symptoms, less than 0.05% have mortality, right? Because of the fact that we have hospitals and good care being delivered, all right? But if you're not treating and you're not aware of it, the mortality rate can go up to as high as 13%, right? How do you know you have an infection? The commonest symptoms you'll see are high fever, which is pretty sudden onset, right? Just suddenly you have a fever and it's pretty high, usually 38 degrees, 39 degrees. And headache. The commonest site that the patients report a headache is in retroorbital, which is behind the eyes. Right? They say that it's paining and it feels like it's paining behind the eyes, the headache is. Then you have body pain. Body pain includes both muscles and joints, and rashes as well as weakness. Also, so since we started the medical part of things, just keep in mind if you have any doubts, you can just put the doubts in chat, right? And once you put the doubts in chat, at the end of this presentation, we'll be having a question answer session where it will be fully interactive. Whatever questions you asked, I'll try to answer it, and you can ask questions in real time in the chat, right? So that we can all not hear overlapping voices. Once that's done, I'll give opportunity for more people to put the questions in chat and then I'll answer them as well. All right. So try not to speak now. Make sure your mics are muted, and we'll continue at the end of the presentation with question answers. So yeah, just a quick recap. Common symptoms are high fever, headache with pain behind eyes, body pain, which can be bone pain as in joint pain or muscle pain, rashes, which are just reddish colored patches, and weakness or fatigue, which is very common. Now, the rarer symptoms, which are a little bit more severe, include nausea and vomiting, abdominal pain or stomach pain, basically, diarrhea, which is loose stools and increased frequency of stools, and jaundice, which is yellowing of eyes, skin, and nails, right? So to confirm the infection, it can't just be purely based on symptoms, right? Because a lot of viral diseases present with the same symptoms. Your doctor might order the following tests. The first is CBC, which is your complete blood count. Your complete blood count is basically done to see your platelet count, right? Since in dengue, your platelets do tend to go down because of loss of water and also attacking mechanisms. Second test is NS1AG and antibodies. So NS1AG is the antigen which is specific to the virus, and antibodies against that antigen are also detected in your body. So this is sort of the confirmatory test that we do. In India, we don't usually use PCR, which is to detect the RNA and DNA of the virus during routine care. And you also do liver function tests to evaluate the liver status of a patient. It is pretty useful in case of the symptoms which I mentioned earlier, right? When you have abdominal pain, jaundice, and vomiting, right? Because the liver can get enlarged in case of dengue, which is one of the rarer but more severe side effects. Then we get on to what to watch out for, right? As I mentioned, some symptoms are severe. When you have these symptoms, it means you need to definitely consider getting admitted, right? Or at the very least, consult your doctor for further advice regarding whether you need to get admitted or not. So, as I mentioned, stomach pain or abdominal pain, right? Persistent vomiting. 1 or 2 episodes of vomiting are acceptable, right? Because you might have a reaction, you might have indigestion, things like that during this phase because you have a loss of appetite as well. So you might have what is known as gas. The second thing, the third thing, which is quite severe, is fluid accumulation or swelling. Now, the fluid in your body in dengue, it goes out of your blood into the other parts of your body where it shouldn't be there. This commonly presents with things like pulmonary edema, which is when fluid goes in your lungs. How you will notice this is you suddenly have difficulty in breathing for no reason, right? And you might see swelling in the hands and feet as well, which is quite rare, but yeah, swelling is seen as well. Then something characteristic, as I mentioned, your platelets go down in dengue. Your platelets are required for clotting, right? So if you're not able to clot, you start bleeding. So mucosal bleeds, which is bleeding in the gums, right? Normally when you brush your teeth, you're not supposed to have bleeding gums. People with dengue, sometimes they notice that just through normal brushing of teeth, their gums are bleeding, which is one of the first signs. And bleeding from your nose as well might be seen. Liver enlargement, like I mentioned, something that is quite severe in dengue is liver enlargement, more than 2 centimeter enlargement. This is seen in case of ultrasounds, right? Not able to be seen as part of routine screening. Then the lab tests which are done will show that your platelet count is reducing and your hematocrit is increasing. Hematocrit increasing means fluid is going out of your blood into other parts of your body. And as I said, platelet count does go down in dengue. Right? Now, how does the disease normally progress? It starts with fever and weakness, the commonest symptoms, and it lasts for 5 to 10 days, right? And it can go beyond 10 days, but normally we don't see that. After day 3, usually you see a decrease in the fever, right? You might go back to normal body temperature. The thing is that when that happens, most people think, oh, okay, I'm fine now. But truth be told, the phase of the disease wherein the severe symptoms or sort of severe dengue is likely to come in is after day 3, right? Once your fever goes, that's when you have to watch out for the warning signs, right? The tiredness or fatigue, which I mentioned, that can last for 1 to 2 weeks, right? You can be fully recovered from dengue, your platelets are normal, your fever is gone, you've not had body pain, but that fatigue can last up to 2 weeks after the infection, right? Now, bleeding, like I said, can come from your gums or nose. How do you know there's bleeding? Otherwise, is in your skin. You might see small red dots or purplish dots or patches, right? The sample image is over here, right? It's not very specific. It's just small red dots or reddish patches or purplish patches, right? They're called petechiae and purpurae in scientific terms. The small ones petechiae, the large ones purpurae. Then, what do you do when you have dengue, right? You know what the symptoms are. Now you've identified you have dengue. How do you progress? So the most important thing, as I kept mentioning, the fluid goes out of your blood, is hydration, right? You need to keep replenishing your fluids to make sure that you have enough fluids. So in all viral infections, this is important. Even in flu, COVID-19, you have to make sure you have adequate hydration. So normally a human being, an adult male, requires 2 to 3 liters of water. Same for female. Closer to 2 liters and 3 liters, right, for females. And you need 1 liter of ORS, lime juice with salt and sugar or coconut water in case of the infection, right? So to replace that sort of fluid that you're losing. This is assuming you don't have vomiting or diarrhea. Now, if you have vomiting or diarrhea, you need another 1 liter of electrolytes, right? Electrolytes are sodium, potassium, chloride, all these ions, which are found in ORS, lime juice, and coconut water, right? So if you have vomiting or diarrhea, you need to replenish that with another 1 liter. And how do you know you have enough fluids? Normally, you check your urine, right? If your urine is light yellow color, you should be okay. But if it's getting darker, dark yellow, orange, then it means that your fluid is low and you have to replenish it, right? Apart from fluids, what else do you do? Rest. As I mentioned, fatigue is quite common. You need to make sure that you're getting a lot of rest because body pain is also going to be debilitating. I personally had dengue, right, a couple of years back, and I was literally unable to get out of bed to even get water to drink. That fatigue was that prolonged, right? And when it comes to the fever, please make sure to use only paracetamol, right? Why? Because if you use other medications like ibuprofen or aspirin, um, these medications have a side effect wherein they affect your platelets as well. Now, in a normal person during normal times, it's perfectly safe, right? Your platelets are able to compensate. But in case of dengue, your platelet levels are already going down. So if your platelets are further reduced or their clotting ability is affected, you might have severe bleeding, right? Especially with aspirin. So that's why you don't have it. In children, aspirin is associated with something called Rey syndrome. It's a disease wherein its explanation is actually quite vague. It's just noticed that in children who have an active viral infection, if you give them aspirin, within 2 to 3 days after they develop Rey syndrome, which is like almost resembling a shock syndrome, wherein it has a very high case fatality rate. So you need to make sure in children you absolutely avoid aspirin. In adults also avoid aspirin and avoid all these other medications such as brufen. Paracetamol is the gold standard for fever and body pain in dengue. Now, what is the dose of paracetamol you can take? In India, since paracetamol is an over-the-counter drug, you can also have access to it. Ideally, obviously, consult a doctor. You have paracetamol in 650 mg tablets. You can take a maximum of 4 tablets in one day. You need to make sure you have a gap of 3 to 4 hours between 2 tablets, right? Obviously, paracetamol is preferred to be had with food or after eating food. And in children, depending on the body weight, usually a dose of 10 to 15 mg per kg is safe, right? You don't just give them 650 mg tablets because if it's a 20 kilogram child, the dose has to be 200 to 250 mg, right? Now, when do you get admitted if you have dengue? As mentioned, these warning signs, which is abdominal pain, right? Continuous vomiting, you're losing fluids constantly before you can replenish them. Fluid accumulation signs, as I mentioned, you have difficulty breathing, swelling of your face, your hands, your feet, things like that. Mucosal bleeding, which is, as I mentioned, bleeding from your gums, bleeding from your nose, and also those patches which I mentioned on your skin, which you can see, the red dots, purple dots, red patches. Liver enlargement, if ultrasound is being done, right, your doctor has advised an ultrasound because he's noticed that your liver function is up, he or she, and then you end up doing an ultrasound and you see that your liver size has increased to 3.5 centimeters beyond normal, then you need to get admitted. Same, as I mentioned, the lab findings. Normally, you do serial labs every 2 days in active dengue. If you're not admitted, if you're admitted, usually every 12 to 24 hours. If you're not admitted and you see that your platelet is constantly reducing and showing a very rapid declining trend and your HCT is increasing, which is fluid loss, then you have to admit again, right? Just a quick sort of note about what kind of interventions do not work in dengue, right? I myself have seen lots of patients do these things. They have goat's milk, papaya leaves or papaya leaves extract, homeopathic or Ayurvedic remedies, right? So goat's milk, just a quick note, I myself have seen patients who've taken goat's milk and have come even worse than before for the simple reason that usually goat's milk is not pasteurized, right? And when something is not pasteurized, it tends to have an increased chance of transmitting other infections, bacterial infections. So patients get things like brucellosis, which is transmitted from goats. And instead of, dengue, which lasts for 10 to 15 days, brucellosis can last for months, right? That patient had to take doxycycline for 2 months just to get rid of the infection. So please avoid things like this. Papaya leaves, a lot of trials out there that are showing that papaya leaves don't increase platelets, right? There's also a bunch of very low evidence trials which are published in really bad journals saying it's good, but those have been debunked multiple times, right? Because think about it, if it worked, we would be doing it, right? It's such a simple, easy intervention. Why would we not be doing it? Because it probably doesn't work. Homeopathic Ayurvedic remedies, in an acute phase wherein you're bleeding, you're noticing liver is distended, you're having vomiting, nausea, these have no role to play. You do need to get admitted. You need to seek acute emergency care. Preventive medicines. So vaccination is being developed for dengue, right? It has in fact been developed and it's being tested out on much larger populations now. But it's been shown that the protection that vaccination gives you is not as high as what is expected. So it's being worked on further to improve it, right? So currently, it's not a part of guidelines. And so, as I mentioned, right, don't take Ayurvedic medications when you have an active infection for the simple reason that all these things that you see here can only be done in a hospital. So even something as simple as fluid replacement, instead of just drinking fluids, you can replace the fluids through IV lines, right? You can have drips, saline, and even dextrose if required, right? If the patient is not able to tolerate eating because of vomiting. Liver function can be monitored much better. You can do those ultrasounds in real time, get liver function test reports, right? Especially in case of jaundice. And in case of dengue lasting for a couple of days, it is possible to get a secondary infection, not from dengue, from something else, and that requires hospital care. And the worst sort of thing that you look out for that people are aware of is, of course, your platelets falling really low. So in case your platelet goes below 20,000 and you have active bleeding and you require plasma transfusions, that can only be done in a hospital setting, right? It can't be done outside. So it's not necessary that you get a transfusion whenever you reach 20,000, right? But below 20,000, you have to be extra alert, looking out for bleeding to do platelet transfusions. Like I said, it can only be done in hospital. Now, as I said at the starting of this sort of seminar, we talked about reinfection, right? And how if you have an asymptomatic infection and you get reinfected much later, why is it a bad thing? So basically, if you get dengue, even if it's asymptomatic, you will develop antibodies and immunity against the dengue virus serotype that has infected you. You have to know that there are 4 dengue serotypes. DME 1, 2, 3, 4, easy to remember. But suppose you get infected by 3, you have protection against 3, but the next infection is by, say, 2, your dengue will actually be much more severe than it was the first time, right? This is why severity of dengue increases if you have a reinfection from a different serotype. If you're reinfected by the same type, normally your immunity completely protects you and you should be asymptomatic, all right? And why is this relevant? Because as you can see, Delhi, based on data from the national testing labs, has an increased prevalence this year, right, in July 2023, of serotype 2. Now, dengue serotype 2 is considered to be a little bit more clinically severe. It is the one that causes severe dengue much commoner than the others. So people in Delhi, please be on the lookout. In Bangalore, you've got DNV 1, 2, and 3 with an equitable distribution, so it's not really different from usual. What it is important to note is, please donate blood frequently if you can, because this is one of the situations wherein having enough blood, plasma, and platelet products is very helpful to people who suffer from dengue, right? So it's a good way to make sure that we don't have too many issues. So let's go through the key takeaways when it comes to this. Firstly, 80% of dengue is completely asymptomatic. You don't even know that you've been infected. Then you realize that 20% of infections are symptomatic with the common symptoms which we discussed: fever, weakness, body pain, right? Being extremely common. What do you have to watch out for? You have to watch out for abdominal or stomach pain, bleeding from many parts, right? Including your nose and your gums, especially if it starts to spread. And keep in mind that this worsening of dengue normally happens once the fever is broken, right? The fever normally bakes between day 2 to day 3 of the fever starting. After that is your chance of getting severe dengue, when you have to keep an active eye out for these symptoms. Please don't be afraid to seek admission in case of severe symptoms. And in case of mild symptoms, always make sure that you're getting enough water, enough rest. That's how you make sure you recover properly. Please use only paracetamol. Do not use aspirin. Do not use ibuprofen. Do not use any other NSAIDs. Don't use antibiotics. As we explained, it's a viral disease. No role of any antibiotics. Do not use papaya leaf. Do not use Ayurvedic medicines, homeopathic medicines, or goat's milk. They have no role in increasing your platelets, right? The whole point is your body has to spontaneously recover from the infection and start making platelets, right? That's how you know it's been fixed. And in case of reinfection, right, you know that you've had dengue, you had symptomatic dengue before, and now again you have symptomatic dengue. It's a good indicator that you've been infected by a different serotype, and you have to be extra careful regarding the warning signs, right? Because like I said, reinfection with a different serotype means you have a higher risk of severe dengue. And of course, please donate blood as much as you can, because this is very useful to ensure that not just in dengue, other times also we have enough blood products, right?